category of individuals are those who have had certain medical conditions, unfortunately, either because of late diagnosis or poor compliance with treatment. They've developed complications out of that disease that then affects all of these things, their abilities to perform. So diabetes is one of them.
Oh dear.
Hypertension is one of them. It can cause great sexual dysfunction.
Okay.
Especially in men. And then that becomes very, very frustrating. If you know about the health-seeking habits of men in this country, it is not, it can be better. It is not what we want it to be.
They are mature about everything.
We're mature about everything. Going to see a doctor, everything you want, why you want to go to the hospital. Again, that's our orientation.
Sure.
So a lot of men are living with diabetes. Diabetes is destroying their that whole system, complex system that is involved in, say, erection and all of those things. So they will be there and they can't perform, and they go hunting for aphrodisiacs. But meanwhile, that's not it.
The problem is not aphrodisiacs.
The problem is not an aphrodisiac. The problem is that you're suffering from hypertension, but you're not aware. You're suffering from diabetes, but you're not aware, therefore you're not getting treatment.
Or the poor compliance.
Or the poor compliance. Some of them know. And Adam, this one, I'll hold my hand up and I say, sometimes we are to blame as clinicians or as doctors. There are quite a number of anti-hypertensive medication, blood pressure medications that have erectile dysfunction or sexual dysfunction as a potential side effect. So we are supposed to put all our patients, the male patients, on notice when we prescribe it. It's not that it causes it, it's that it has the potential to cause it. So that when they begin to experience it, they know, and then they come and report, and then we can switch. But most of the time, our counseling is not about that. We'll tell you about the other side effects. You might get some gum bleeding and gum swelling. You may get a dry cough. We'll tell you about all those things. We tend to sort of like even forget about erectile dysfunction. And you see, man, we don't complain, especially these things about poor sexual function. It hits our ego really, really hard. So if he can't perform, he won't go and tell anybody.
No.
If you come into the hospital, but some of them they figure out, then they drop the medication.
And then you get a different set of complications.
You get a different set of from which you may not be able to recover. So we as clinicians, we ought to do better.
Great.
And by putting them on notice. So that's part of the compliance thing. If you don't tell them and they find out, then they ditch the medication. But then the other bit of the compliance thing is just
take your medication.
Take your medication, and then you'd be okay.